If your hands or feet feel like they're being stabbed by thousands of tiny needles, or if you experience a constant burning sensation that never seems to go away, stop what you're doing and pay very close attention, because what I'm about to share has literally transformed the lives of people over 60 who were on the brink of losing sensation in their extremities. And it doesn't require expensive procedures, risky surgeries, or complicated diets. It's something many of you already have the ability to use in your own home, and it works faster than you might think. My name is Dr. Emily Carter, and for over 20 years, I have worked with adults over 60 struggling with nerve damage, neuropathy, tingling, numbness, and that relentless burning or pins and needles sensation in their hands and feet. And over that time, the one thing that has consistently broken my heart is how many patients suffer unnecessarily simply because no one told them the simple, science-backed steps that could reverse this damage and restore quality of life. Imagine a 67-year-old patient of mine, Margaret, who came to me in tears because she could no longer feel her grandchildren's hands when they held hers. She had dropped countless objects, fallen multiple times, and needed her daughter's daily help to button her own clothes. She was a lifelong seamstress, had spent decades working with her hands, yet she was facing a life of frustration and dependence. What caused this, and what ultimately solved it, was far simpler than anyone expected. The solution revolves around a specific B vitamin your nerves are desperately crying out for. A vitamin that, when supplemented correctly, can rebuild nerve insulation, restore proper signaling, reduce numbness, and eliminate burning sensations within weeks. But before I get into the details, check in with your own body right now. Do your hands or feet tingle at night, or when resting? Do you struggle to feel temperature changes in water, or find buttons more difficult to fasten than they once were? Have you ever felt unsteady walking, or had a burning sensation that never fully goes away? Even if you answered yes to just one of these questions, your nervous system is sending out a distress signal, and ignoring it can have serious long-term consequences. Most people think of these symptoms as simply a part of aging, but that's a dangerous misconception. Left untreated, nerve damage can progress to permanent loss of sensation, a higher risk of falls, decreased mobility, and a rapid decline in independence and overall quality of life. Understanding what's happening inside your body is crucial, because your nerves are like electrical wires that run from your brain to every part of your body. Your fingers, your toes, every muscle, every tissue, every organ. For these wires to work properly, they need insulation, a protective layer much like the plastic coating around an electrical cord. Without it, signals misfire. After the age of 60, our body's ability to maintain this protective coating, called myelin, diminishes sharply. As myelin degrades, nerves become exposed, signaling becomes erratic, and that's when tingling, numbness, and burning pain appear. Here's the critical point most people never hear. There is a specific B vitamin that your body cannot do without when it comes to repairing and maintaining this protective coating. Without it, nerve repair cannot happen. With it, damaged nerves can start healing, sensations return, and daily life becomes manageable again. That vitamin is vitamin B1, also known as thiamine, and before you dismiss it as just another supplement, understand this. In my practice, I have seen patients who couldn't hold a cup of coffee without spilling regain full dexterity in their hands, and people who had lost feeling in their feet regain confidence in walking without fear of falling. It's not magic, it's biology. It's the body finally getting what it's been missing. Think of it like this. If you owned a car but never changed the oil, the engine would eventually seize. Vitamin B1 functions like oil for your nervous system. It lubricates, protects, and ensures signals flow smoothly from your brain to every part of your body. When B1 levels are too low, the nervous system runs dry, misfires occur, and that's when the pins and needles sensation begins, numbness develops, and walking or holding objects becomes dangerous. But when the body receives the B1 it needs, the repair process begins. The protective coating around nerves rebuilds, Signals travel clearly again. Numbness fades, and sensation gradually returns, almost like a dim light slowly being turned back on. Many people assume they get enough B vitamins from food, but the reality is startling. Up to 1/3 of adults over 60 are deficient in B1, and those numbers rise dramatically for anyone taking certain medications, like metformin for diabetes, water pills for blood pressure, or even some medications for acid reflux. Aging itself plays a role too. As we grow older, stomach acid production drops, and absorption of B1 from food decreases drastically. A healthy 30-year-old might absorb 60-70% of dietary B1, whereas after 60, absorption can plummet to 20 to 30%, meaning even a seemingly adequate diet can leave you deficient. Modern food processing compounds this problem. White bread, white rice, and highly processed foods are stripped of much of their B1 content, leaving your body starving for a nutrient it desperately needs to protect your nerves. Let me give you a concrete example. A 71-year-old patient of mine, extremely health conscious, ate plenty of vegetables, avoided junk food, and walked daily, yet reported numbness in his feet so severe it felt like walking on thick socks and made driving frightening. Blood work revealed dangerously low B1 levels, and his medications were the hidden culprit. Diabetes medication and a water pill had silently depleted his B1 reserves for years. After starting supplementation, within 3 weeks, he called me in tears, saying he could finally feel his feet, the gas pedal in his car, the ground under him while walking. He felt safe, stable, and alive again. Stories like his and Margaret's highlight an inconvenient truth. So many adults suffer unnecessarily, and the solution is simple when properly understood and applied. Now, let's talk specifics. First, the form of B1 matters. Not all supplements are created equal. The form you need is benfotiamine, a derivative of thiamine that is far more bioavailable than regular thiamine. Regular thiamine can break down in the stomach before it reaches your nerves, while benfotiamine stays in the system longer, penetrates nerve tissue more effectively, and has been shown to repair and regenerate damaged nerves. When shopping for supplements, check the label carefully for benfotiamine. If the bottle only lists thiamine, it can help, but benfotiamine is significantly more effective for active nerve repair. Next, dosage is critical. For nerve repair, I recommend 150-300 mg per day of benfotiamine. This is the therapeutic range supported by research. Start with 300 mg if symptoms are severe. 150 mg may suffice for mild tingling. There is virtually no risk of overdose because vitamin B1 is water-soluble. Your body uses what it needs and safely excretes the rest. Absorption is enhanced when taken with a meal containing a small amount of fat, like eggs, avocado, nuts, or olive oil, so never take it on an empty stomach. Consistency is key. Take your B1 each morning with breakfast, making it part of your daily routine. Many patients notice early effects within the first week. More energy, clearer thinking, improved mood, before nerve improvements are even felt. By week 2, early nerve signal restoration often begins. Tingling may decrease, hands and feet start to feel more alive, and subtle improvements in balance appear. By weeks 3 and 4, the changes become more pronounced. Numbness fades, the ability to detect textures returns, coordination improves, and confidence in walking increases. By months 2 and 3, most patients describe life-changing improvements. Burning sensations disappear, numbness is dramatically reduced or gone, and they resume activities they had quietly abandoned, like knitting, gardening, or driving safely. Importantly, vitamin B1 works best in combination with B6 and B12. These vitamins act synergistically, accelerating nerve repair, protecting neurons, and supporting long-term nerve health. When choosing a supplement, look for a high-quality B complex containing benfotiamine as B1, at least 100 mg B6, and 1,000 mcg B12. Alongside supplementation, lifestyle considerations amplify results. Stay well hydrated, Eat B1-rich foods such as whole grains, beans, and lean pork. Avoid alcohol, and maintain moderate physical activity to support circulation and nerve health. Equally important are medical precautions. Get proper testing to confirm B1 deficiency, review current medications with your doctor, and adjust dosages as needed, especially for diabetes, water pills, or other drugs known to deplete B1. Starting supplementation without guidance is possible for most, but medical oversight ensures optimal safety and effectiveness. To summarize, here's your 4-week action plan. Week 1, get blood work to check B1, B6, and B12 levels, and start benfotiamine 150, 300 mg daily with breakfast. Week 2, begin a B-complex supplement containing benfotiamine, B6, and B12, taken consistently with meals. Weeks 2 through 4, maintain a symptom journal, noting tingling, numbness, and other sensations daily to track progress. Week 4, follow up with your doctor to review improvements and vitamin levels. Beyond the first month, continue supplementation, maintain a B-rich diet, avoid alcohol, and ensure hydration. Real-world results speak volumes. Regain strength, stability, and independence, and their quality of life improves dramatically. Margaret, for instance, after just 2 weeks of supplementation, could feel her hands again, and by 6 weeks, she buttoned her own clothes. 3 months later, she returned to sewing and knitting, activities she thought were lost forever. This approach isn't limited to one patient or one condition. Hundreds of my patients over 60 have experienced similar transformations, regaining confidence, comfort, and control over their lives. The underlying science is clear. B1, particularly in the form of benfotiamine, rebuilds nerve insulation, restores proper electrical signaling, and reverses symptoms caused by deficiency. And when combined with B6 and B12, the results are accelerated. If you or someone you love is over 60 and experiencing tingling, numbness, burning, weakness, or balance issues, take action now. Test vitamin levels, supplement correctly, and make simple lifestyle adjustments that support nerve health. Daily consistency, the correct form and dosage, and synergistic vitamins can literally transform the way you feel in weeks. Your hands, your feet, your overall independence, and your confidence in movement do not have to decline with age. By addressing B1 deficiency head-on, you can stop the progression of nerve damage, restore sensation, and reclaim control over your life. Share this information with loved ones who might be silently suffering. Leave a comment describing your symptoms, and ask any questions about the process. I read every comment and offer guidance wherever I can. Remember, this is not a theoretical discussion. It is actionable, science-based, and proven in clinical practice. I am Dr. Emily Carter, and your best years don't have to be behind you. With the right knowledge, consistent action, and the correct supplementation protocol, you can overcome nerve damage, restore feeling to your hands and feet, prevent further decline, and live with confidence, independence, and comfort. Start today, follow the plan, and witness the transformation in just weeks. Thank you for watching, and I look forward to sharing more practical, research-backed health tips designed specifically for seniors in future videos.